Good evening, everyone. I want to thank you for attending this evening's webinar. Today, we are going to be presenting information regarding Traumeel, Zeal, and Spaskapril and applications regarding IV and epidural therapies. With us tonight, we have the pleasure of Dr. Kianfa Martinez-Liu. She's a well-respected practitioner with over a decade of experience treating patients with both chronic pain and acute pain, using an interdisciplinary approach of both allopathic medicines and Medi-Natura injection solutions. Dr. Martinez-Liu is ABA board certified in general anesthesia with subsequent special subspecializations in liver and solid organ transplantation, and is ABA and ABPM board certified in the subspecialty of pain management. Dr. Martinez-Liu actively participates in medical research and has numerous published studies. She is a member of numerous societies, including, but not limited to, the ASIPP, the American Society of Anesthesiologists, and the American Pain Society. Currently, Dr. Martinez-Liu practices at Jackson Memorial Hospital and All Pro Medical Center Pain Management Center, located in Hialeah, Pembroke Pines, Wellington, and Hollywood. Dr. Martinez-Liu, how did you become familiar with Traumeel and Zeal?
Well, that's a very funny story. I just graduated from a pain management fellowship, and I had this old patient who comes in and unravels a little vial that she has in her purse, and she says, "Doctor, I need you to inject this thing." And I take the vial, look at it, and it says Traumeel. For God's sakes, I don't know what this is. I give it back to her, and she says, "This is what keeps me going." And then I said, "Fine, how many times have you had this done before?" She goes, "Many times." And I said, "Sure." I had my little, should I say, I was doubtful about what was I about to do, injecting somebody with a medication that I didn't know anything about. I went ahead against my best advice and, broke it, injected on the lady. And then next month, she came back again with a vial just to do it one more time. I say, I need to find out more about these medications. Where does she get it from? How is it possible that I spent all these years and I never heard of this thing? And that was the first few steps that I took in order for me to become familiar with the homeopathic medications that Medi-Natura offers and how I could use it to make my patient's life better. So years passed by. I started reading some literature about them, and I started using them almost on an everyday basis in all the patients I was treating for disc herniations, epidurals, and wherever there was a pain, I could create a combination of these medications to make my patient's life better. So that's how I first became familiar with these products, and that's how I was able to use them to help many people along the line, and I am a firm believer in them. So let's talk a little bit about the medications, how they work. We don't know a lot about the entire mechanism of action, but we know sufficient to make them useful in our day-to-day practice. So Traumeel, for example, you're going to be seeing here in this slide, Traumeel acts very early at the cascade of inflammation. Traumeel acts at the T1, T2 cells and make them reduce interleukin secretion. And we all know interleukin secretion is one of those things that drives the immune system. If we don't have the right interleukins being secreted, then basically we don't move on to stimulate the B cells, which in turn will produce antibodies. And then the cascade gets amplified because these mast cells will produce both the histamine and heparin as well as the phospholipids. And those phospholipids will eventually go on the cascade to produce arachidonic acid and the thromboxane and prostaglandin/leukotriene pathway, which we are all very familiar with the NSAIDs. That's pretty much the arachidonic acid is where the NSAIDs work. So basically, Traumeel will have its action much earlier in the cascade, which make it very useful because basically that inflammation that we have will never get to the point in which we will need an NSAID because it will happen much earlier. There was a study done in which they were able to expose Traumeel to both resting cells and activated cells. It was found that three very important interleukin-8, interleukin-1 beta, and tumor necrosis factor. These three are pretty much the sine qua non of inflammation. For example, without interleukin-8, interleukin-8 is a chemokine. Without interleukin-8, there will be no calling of the inflammatory cells to the active tissue inflammation. Therefore, by decreasing interleukin-8 by 50% in both resting and activated cells, you will have less communication between the system and less able to bring both neutrophils and monocytes to the site of this chronic inflammation. Now, let's talk about tumor necrosis factor alpha. Many autoimmune disorders actually have we use drugs nowadays that will decrease tumor necrosis alpha. Humira, for example, Enbrel. All these medications act at this particular interleukin, and as you could see, resting cells will decrease at 65% the amount of tumor necrosis factor that they will produce, and activated cells will be a 54% reduction in tumor necrosis factor alpha. Interleukin-1 beta, in fact, this is another one of those that pharma companies have targeted to use in rheumatoid arthritis treatment, and now we have FDA-approved medications which will actually target this particular interleukin to decrease it. So, Tromil in vitro, this study was done in vitro, will be able to reduce interleukin-1 beta, tumor necrosis factor, and interleukin-8. So now let's talk a little bit about SEAL. SEAL acts in the arachidonic acid level. We remember that Tromil does it before. Now SEAL is like after the beta cell activation / mast cell degranulation. In this case, SEAL decreases both cyclooxygenase 1 and 2, and as well as the lipoxygenase pathways, and they all together, they will produce downregulation of the inflammatory cascade. In the next slide, we can see that we not only will be able to reduce inflammation, but also decrease the tissue destruction as well as tissue remodeling. Many of this tissue remodeling is due to the influx of these inflammatory cells, which will not happen because of the combined action of these homeopathics. You have to understand that homeopathic formulations have multiple ingredients, and each one of them, which you can see here in the blue squares, each one works at a different step in the inflammatory response of the body. So in the slide you can read which one works where, but the end result is pretty much the same. You will have decrease in tissue destruction, decreased tissue remodeling, as well as decreased inflammation. And if we have decrease on all that, of course there will be a decrease in tissue acidosis. The Spascupril. Spascupril is more along the lines of reducing spasms that are produced with either nerve damage or coming from the CNS. If you have a nerve that is being pinched by a disc, but that is being pinched either by arthritic formation, what's going to happen that irritated nerve is going to send aberrant signals to the distal muscle. When that aberrant signal reaches the muscle, what happens is that muscle becomes spastic. And by becoming spastic, then the pain will ensue. And many of these patients, before you actually have a diagnosis of a disc herniation, you will have severe spasm both in the neck or in the low back. And when I feel some stereotypical muscle spasms, I know to send this patient already for an MRI, and I know exactly, given the distribution, what kind of disc herniation I'm going to find. So basically, Spascupril will act in the decreasing adrenergic and cholinergic outflow, and therefore producing muscle spasm reduction. So the indications, as we said, the Spascupril will be mainly for muscle spasms. The SEAL, I use it either combined or alone for anything that has to do with arthrosis, anything that has to do with autoimmune processes that will destroy cartilage, and the Tromil is the go-to man. Basically, anything that has to do with pain, anything that has to do with inflammation, Tromil you can use in any of those instances. So, and yes, you can combine the medications, and we will be talking about that a little bit later. Contraindications, Pretty much there is no non-contraindication for any of these medications except for hypersensitivity. And I don't think this is approved for during pregnancy. It's category C. And the amount of medication or the dose response curve has not been studied in children or the elderly. So, as I mentioned before, these medications can be used as cocktails. You can use them alone. I have mixed them together with lidocaine. I have mixed them together with Marcaine. I have mixed them together with all kinds of steroids, not necessarily Celestone. Like in here, I've mixed them with Depo, with dexamethasone, and the results are great either way. I want to talk a little bit about the IV administration protocol. I know in the primary care sector, as well as in also specialists, it doesn't matter who you are in medicine, you will eventually encounter fibromyalgia patients. So this is a very good medication to use in this population because, like we discussed with the mechanism of action, we don't know exactly what causes fibromyalgia. We know sort of how to diagnose it. We know that they lose some kind of an amount of neurons in the CNS. Nobody knows really why. This could be a generalized state of inflammation in the body. We don't know. So basically, the combination of Tromil with Seal administered with lidocaine, because the injection could be a little bit painful. Either in IV or intramuscular, it could be a little bit painful. Either way. So the lidocaine is there for that purpose. Administered once a week for 4 weeks is an excellent adjuvant for the fibromyalgia therapy. The patients will be very happy with it, and they will feel that they will have less stiffness in the morning. They will be able to be more mobile. They will be able to do things that otherwise they would not have been able to do. Also out there, my friend, the rheumatologists, they have the rheumatoid arthritis people, the lupus people, the mixed connective tissue disorder patients, even the ankylosing spondylitis, the seronegative arthritis. This could also be used. In this case, again, 1 Tromil with 1 Seal. And if a spasm is a great component of the problem, then you could add a Spascupril as well to the mixture. You administer that once a week for 8 weeks. And for example, whenever you have a flare-up, the patient can have this protocol done, and once the flare-up subsides, basically they can go back to their maintenance regime, whatever that might be. And as I mentioned from the beginning, many of the drugs that are used in RA, SLE, they target that particular tumor necrosis alpha factor, which is decreased by the use of Tromil, as shown by our in vitro studies. Diabetic peripheral neuropathy or neuropathy of any kind. I have tried with different form of neuropathy, including HIV neuropathy. You can use the Tromil and Spascupril, administer once a week for 4 to 6 weeks when the neuropathy is flaring up, and it's an excellent adjuvant to your regular therapy. In my practice, I do see a lot of rheumatic diseases in pain. And the patients come and they receive these treatments. But my main bulk of practice is the disc herniations, the spine procedures, and in anything and everything, there is a little spot for one of these medications. For example, disc herniations, I administered, that's my classic formula, the Tromil with the Seal, and I do it either with a series of 3 epidural, or I do it like every time an epidural is done. For example, facet arthropathy, sacroiliitis, either like sacroiliitis by itself or together with ankylosing spondylitis, responds very well to the administration of Tromil and Seal. To me, that's the perfect combination because the Seal will address the arthropathic or arthropathy aspects of the disease, while the Tromil will decrease a lot of the inflammatory aspects of the disease. And for example, another condition that also exists a lot and many of our patients walk around with, and we don't have a lot to do for them, coccydynia. A pericoccid injection around in the area with Tromil and Seal will do wonderful, for these patients, as well as using our coccyx pillow. We have here a little slide that, is just to show us the epidural space and the different places where this particular injection can be placed. For example, intraarticularly, intradiscal, epidurally, and all of them will eventually, result in improvement of the patient quality of life. So now, I want to leave you, before I move on to a study that I want to review with you guys, I want to leave you with a very important message. All this patient population that I mentioned, we prescribe NSAIDs, we prescribe narcotics, but I want to leave you with this message in mind that our therapy, our conservative therapy for this patient, for example, NSAIDs, in the elderly population, 41,000 of these people that we prescribe NSAIDs every year end up hospitalized, either because they have a bleeding ulcer, because they have a CHF exacerbation, an acute MI, or renal or nephropathy, acute nephropathy, due to our prescription of NSAIDs. It's real, it's out there, and in my hospital practice, I see it all the time. So that particular alternative for therapy is not necessarily completely benign, and it's not necessarily suited for everybody or every patient in our practice. On the other side, opiates. We have about 200,000 people that have died from 1999 to 2016 due to opiate overdoses. We have drug overdose, prescription drug overdose to be more specific, to be a serious problem. And roughly 450,000 people die as a result of a drug overdose only in 2015. So opiates is the other commonly prescribed medication that we give to these patients to treat their pain and their suffering, which is not necessarily also the best alternative. So that is where I decided to introduce these homeopathic remedies to my arsenal of things that I could do with patients. For example, that diabetic patient who has already nephropathy, who has already diabetes, who has already other comorbidities, heart problems, and she's too elderly to start her on opiates at this point. What do I do with her? And so that's where this stuff came into my life, and I am very grateful that it did. So every patient that we see in the office, I want to review this slide in which we have the different risks. For example, cardiovascular disease. Tromil will not have any contraindication or non-interaction with any of the medications in there. However, if we use corticosteroids in an indiscriminately manner, basically you'll have problems causing congestive heart failure. You could worsen their hypertension and the renal insufficiency. NSAIDs, the same situation that we just discussed. Patients with uncontrolled diabetes, and you give a large dose of steroids, the same situation, their sugars are going to increase. And if you give them NSAIDs, basically you're going to worsen their kidney, and together with the diabetes, which is also another kidney killer that we all know about. In this case, Tromil has no known interaction. Patients on polypharmacy, we know that there is at least 694 drugs that will actually interact with corticosteroids, and as many as 437 drugs that will have drug-on-drug interaction with NSAIDs. To me, that's basically what we do every day. I give prescriptions of NSAIDs, and sometimes I say, am I doing the right thing? So it is well known that steroids will, potentially cause tendon rupture. They will actually cause tissue destruction. For example, it is well known, the orthopedic surgeon that calls you, hey doctor, we had to do a knee replacement because you had a steroid, you put a steroid crystals in somebody's knee. Why? Because after so many injections of cortisone, the cortisone crystals start crystallizing, in the joint space. And basically, that's not necessarily something good either, even though the patient is in pain. So the presence of or the existence of something like Tromil, which you could actually use for these purposes, lessens the amount of side effects that you could potentially would have had it not been an alternative to use in these patients as well. So let's talk a little bit about the Moser trial. Basically, this was a randomized, double-blinded, placebo-controlled study in which they used Tromil and Seal combined, like I explained that I use for my patients, and it was injected intra-articularly 3 3 times, day 1, day 8, and day 15. So it was a series of 3 injections. And they use as their endpoint the Western Ontario McMaster questionnaire for hip and knee. And here we have a slide that shows that at 32.6% points decrease in pain of placebo versus our combination of Traumeel and Seal, which is pretty much the same as our standard therapy for the treatment of knee pain in moderately to severe pain of the knee. So again, if we have such numbers, something that versus the possibly high side effect medication, why not at least give it a try in a patient? That patients were followed up to 99 days, and in the 99 up to the 99 day, they still retain their benefits of the Traumeel Seal combined injection. So now I will open for some questions from the audience.
Thank you so much, Dr. Martinez, for your time. Okay, now everyone, we're going to open up the forum for questions. So we have a few ways that you can submit your questions. We know that there are a variety of roundtables going on right now across the nation, so you're more than welcome to type your questions in electronically. We have that available. You can also text questions in, and then I have a few to start with.